Imagine living in a time when sadness, anxiety, or even simply behaving differently was not seen as part of life. They were considered dangerous illnesses, and the cure could be a surgery. That cut into the brain, this was the fate of thousands of people, and perhaps it could have been yours. We are talking about the lobotomy, one of the darkest chapters in modern medicine today. The word sends chills, but for decades it was seen as an incredible breakthrough, a miraculous cure for problems. Science didn't yet understand the person behind this idea was Portuguese neurologist Antonio Egas. Menezes in 1935, he introduced the procedure called leucotomy later. Known as lobotomy, Menezes believed mental illness was caused by defective connections in the brain, by severing these connections. Anger could be silenced, emotions controlled, and peace restored to patients deemed incurable. The medical community applauded hospitals, saw hope where there was once only despair, and in 1949, Menezes was awarded the Nobel Prize in Medicine. But far from the applause, reality was cruel. Many patients after surgery never saw nemi spengend, never so send years, never send descent, penusens klebus. Lobotomy didn't just erase symptoms, it erased symptoms. Didn't betterment imwaitable, bettermus preterment, meniment betterment, benedel, wenit, prenistewed, to menet cand ba wentia, bitan, wan, baman, basin, wepend, banner, bib, and bet fly ha, bapman the big bap cut the bap up with ban wick are dapam. If in Europe, lobotomy began to attract attention, it was in the United States that it reached terrifying proportions. The man behind it was Walter Freeman. Freeman was not a surgeon, but he believed he had found a faster, simpler, and more accessible method. For performing lobotomies, his favorite tool wasn't a surgical instrument. It was something resembling an ice pick. Using a small hammer, he would insert the tool through the thin bone above the eye, and with a few strikes reach the brain, then he moved the instrument back and forth, severing neural connections, brutally. This procedure, called the transorbital lobotomy, didn't require a surgical theater. No general anesthesia was needed. In just a few minutes, it was done. Freeman traveled the country in his van, known as the lobotomobile. Hospitals, clinics, and even public institutions saw dozens of surgeries performed in a row, like a production line. To society, at the time, it seemed like a breakthrough. Agitated, violent, or problematic patients left the procedure calm, docile, often unable to respond. The cost, however, was devastating. Many lost the ability to think or feel, others suffered severe motor disabilities, and thousands died on Freeman's table. Yet, lobotomy became fashionable. Newspapers hailed it as the surgery of hope. Doctors and families believed they were witnessing a definitive solution to mental suffering. But behind the propaganda lay one of the cruelest chapters in medical history. Among the thousands of patients who went through Freeman's hands and others, some names became infamous. One of the most well-known cases is Rosemary Kennedy, sister of future U.S. President John F. Kennedy. Rosemary was a lively young woman, but from an early age she struggled with learning difficulties and behavioral issues. Her family, fearing scandal and believing in the promise of medicine, allowed her to undergo a lobotomy in 1941. The result was devastating. Rosemary lost coherent speech, suffered limited movement, and spent the rest of her life in institutions. A promising young woman, erased by a procedure that should never have existed. But Rosemary was not alone. Thousands of ordinary people faced the same fate. Adolescents taken by parents who could not accept rebellion. Women deemed difficult or suffering from depression. Soldiers traumatized by war, diagnosed with incurable nervous disorders. All of them became victims of a socially sanctioned experiment. The numbers are staggering. In the United States alone, over 40,000 lobotomies were performed in Great Britain. Around 17,000 and other countries practiced it as well. Always with the same consequences: lives destroyed in the name of a supposed cure. The image of patients after surgery was haunting. Some remained almost vegetative, others lost all trace of personality. Becoming apathetic, emotionless, the promise of hope turned into a silent nightmare, a silence echoing through the corridors of psychiatric institutions. For years, lobotomy was celebrated as a miracle, but gradually the consequences became impossible to ignore. Medical reports showed patients unable to live independently, suffering cognitive and motor impairments. Tragic cases, like Rosemary Kennedy, gained public attention. Families who once believed in the cure began to speak out against the horrors of the procedure. Yet Walter Freeman continued his crusade. He performed over 3,500 lobotomies during his career on one shocking occasion. He performed 25 surgeries in a single day. But in the 1950s, everything began to change. Science finally offered an alternative. The first effective antipsychotic drug was introduced, chlorpromazine, also known as thorazine. Unlike lobotomy, the medication didn't require a scalpel, it didn't destroy brains, and it produced much more promising results in treating mental disorders with the rise of modern psychiatry and new medications. Lobotomy was increasingly seen as outdated, even inhumane, by the 1960s. The procedure was in decline, and in 1977, the United States officially banned lobotomies in federal hospitals. Other countries followed suit, and the practice almost completely disappeared. What remained was a dark legacy, tens of thousands of lives irreversibly marked, erased, or destroyed by a surgery that should never have existed. Lobotomy went down in history as one of modern medicine's most brutal mistakes, a procedure that promised hope but delivered silence, pain, and oblivion behind the statistics were faces. Parents, children, brothers, sisters, people who trusted science and lost the most human part of themselves. Their mind, their essence, their identity. Today, lobotomy serves as a warning, a dark reminder that the pursuit of progress without ethics or limits can turn healing into tragedy. If in the past, people believed cutting the brain was the solution, today we know the mind is a delicate territory, requiring care, respect, and humanity. Yet the question remains, how many similar mistakes are happening? Right now, in the name of science, which experiments applauded today will be seen as horrors, tomorrow the story of lobotomy forces reflection and demands remembrance, because sometimes the greatest danger isn't the illness, it's the cure.